Dr. Jigyasa Pasi, Assistant Professor, Department of Anatomy, Hamdard Institute of Medical Sciences and Research, New Delhi. Okay, so the learning objectives for today's lecture are: at the end of this lecture, the students should all be able to discuss the division and the boundaries of the perineum, discuss the perineal body, and finally discuss in detail the ischioanal fossa, the boundaries, content, and the clinical aspect. Now, so what is the perineum? Basically, it is the region at the lower end of the trunk that lies between the two thighs, and the external genitalia is located within the perineum. It is forming the lower division of the pelvis that lies below the pelvic diaphragm, which we'll discuss further on, basically formed by the muscle levator ani and the coccygeus, and the pelvic outlet or the inferior aperture of the pelvis. Okay, so like we've seen that in males that there are two openings, one for the gastrointestinal system and the other being the common opening for the urinary and the genital system. In the female, as depicted in this photo, there are three separate openings, one for each of the gastrointestinal, genital, and the urinary system. The perineal body is supporting the reproductive system, and any injury without repair may lead to the prolapse of the uterus. Pudendal nerve is supplying the muscles, the skin, mucous membrane of both the anal and the urogenital triangle that is comprising of the perineum. Pudendum actually means to be ashamed of, but because we are all scientific reading anatomy, there is nothing to be ashamed of. Okay, so this is the bony pelvis, right? This is the pelvic inlet, this is the pelvic outlet. This is the pelvic diaphragm comprised of the levator ani and the coccygeus muscle, and below that is the perineum area over here. So coming to the superficial boundaries of the perineum, if you see in the males, anteriorly it is bound by the scrotum in males and the mons pubis in females. Posteriorly we have the buttocks, and on each side we have the upper part of the middle side of the thigh. Okay, so coming to the deep boundaries of the perineum, after this, this is just superficial. The deep boundaries of the perineum are the same of that of the pelvic outlet. The pelvis will be dealt in a separate topic, the bony pelvis. You'll understand that better with this. Now, so anteriorly, upper part of the pubic arch over here, okay, or the inferior pubic ligament, okay. Posteriorly, the tip of the coccyx. On each side is the conjoint ischiopubic rami, the ischial tuberosities, and then the sacrotuberous ligament from the sacrum to the ischial tuberosity part of the hip bone. Here, this is more clear. So this is the bony pelvis. This is the pelvic outlet, which is the same as the boundaries of the deep part of the perineum, right? So anteriorly we have the arcuate pubic ligament. Posteriorly we have the coccyx. In the middle we have the perineal body over here, which we'll talk about in detail later on. On either sides we have the conjoined ischiopubic rami, right? And then we have the sacrotuberous ligament from the sacrum to the ischial tuberosity. Now, if we, for our better understanding, we are going to divide the perineum into two parts, right? So there is a transverse imaginary line joining the anterior part of the ischial tuberosities, and it is passing immediately anterior to the anus and is dividing the perineum into two triangular areas. Okay, one triangular area is this and the other one is this. Okay, so we have a posterior triangle called the anal triangle. This is the anal triangle or the anal region, and the anterior one we have the urogenital region, okay, or urogenital triangle. The anal region, as the name suggests, will contain the termination of the anal canal in the median plane and the ischioanal fossa on either sides. Now, the urogenital region contains the external urogenital organs. They are in males the urethra, which is enclosed in the root of penis, partly hidden anteriorly by the scrotum, and in females we have the female external genital organs. In the urogenital region, we have there are superficial and the deep perineal space or pouches, and the deep and superficial perineal spaces or pouches. The chief neurovascular bundle of the perineum occupies a facial tunnel, the pudendal canal, that is containing the pudendal nerve and the internal pudendal vessels. The pudendal canal will also be dealt with in detail. The pudendal canal lies in the lateral wall of the ischioanal fossa. We'll do this in detail later on. So, coming to the anal region, this is the anal region. When we talk about the cutaneous nerve supply, we have the inferior rectal nerve, right? So can you see? This is the inferior rectal nerve and vessels that is supplying the skin over the anus and around the ischioanal fossa. Okay, so median structure we have the anal opening that is guarded by the external anal sphincter. On either sides, we have the ischioanal fossa. Also, along with the inferior rectal nerve, we have the perineal branch of S4 or the fourth sacral nerve supplying the skin posterior to the anus. Okay, so after which we have the superficial fascia, which contains a large amount of fat which is filling the ischioanal fossa. Coming to the deep fascia, it is formed by the inferior fascia of the pelvic diaphragm, which we'll do further on, and the fascia covering the obturator internus below and the attachment of the levator ani. Okay, so this is a dissected specimen showing the anal triangle. This is the anal opening, and this is on either side we have the ischioanal fossa. You can see the inferior rectal nerve over here and artery, right? Right, okay. So this is the coronal section through the ischioanal fossa. As you can see, it's the anal opening. On either sides, we have the ischioanal fossa. This is the perianal space that is filled with fat, okay. And then we can see the inferior rectal nerve supplying this area. So moving on further, we'll talk about the anococcygeal ligament. It is a fibrofatty mass permeated with muscle fiber derived from the levator ani and the external anal sphincter, extending from the anus to the tip of the coccyx. Okay, so this is basically your anococcygeal ligament. Okay, from the anal canal to the tip of the coccyx called the anococcygeal ligament that is also supporting the rectum, right? Now, according to competency AN 49.2, we should be able to describe and identify the perineal body. So, let's see next what exactly is the perineal body. Right. So, basically, it is the central point of the perineum we have seen previously is a fibromuscular node situated in the median plane about 1.25 centimeter in front of the anal margin and close to the bulb of the penis. The importance lies within one particular thing, that is 10 muscles of the perineum are converging and interlacing at the perineal body. There are two unpaired and then we have three paired. The two unpaired are external anal sphincter and the fibers of the longitudinal muscle coat of the anal canal. Amongst the paired, we have the bulbospongiosus, superficial and deep transverse perineum, and the levator ani muscles. All of them are converging and interlacing at the perineal body. And the last one is the unstraight fibers of the longitudinal muscle coat of the anal canal. Okay, so we have 1, 2, 3, 4, 5, 6, 7, 8, and 9, 10 muscles converging at the perineal body. here. So this is the perineal body over here, okay? Important in female because it is supporting the pelvic organs. The sphincter uretrovaginalis in female is also attached over here. As the name suggests, sphincter uretrovaginalis, a sphincter around the urethra, may be damaged during childbirth, okay, and it may result in the prolapse of the urinary bladder, uterus, the ovaries, and probably the rectum also, okay. So as you can see, this is the perineal body. The unpaired muscle was the external anal sphincter over here, okay, and the muscle cord coming from the anal canal. Amongst the paired was the bulbospongiosis, as you can see clearly over here, okay, the ischiocavernosus. This is the superficial and the deep perineum muscles, okay. So we have, again, let's see, external anal sphincter, as you saw clearly last time in the last picture, the muscle cord, longitudinal muscle cord of the anal canal, bulbospongiosis, superficial transverse perineum, deep transverse perineum. As you can see, do not get confused. The ischiocavernosus is not converging at the perineal body, but the levator ani is. Okay. So these are the muscles interlacing over here, and if there's a damage to the perineal body, can lead to the prolapse of the pelvic organs. Now, so what is this external anal sphincter that we spoke about? Basically, the anal canal is surrounded in its upper three-fourth by the internal anal sphincter. ये रहा internal anal sphincter, okay, which is ending below the level of the white line of Hilton, right? Then we have the external anal sphincter that is surrounding the whole length of the anal canal. It is supplied by the inferior rectal nerve and by the perineal branch of the fourth sacral nerve, and very important, under voluntary control, and keeps the anus and the anal canal closed, okay. So you can see this is the external anal sphincter. It has a superficial part, it has a deep part, and then it has a subcutaneous part, and this will be dealt in detail when we do the anal canal. So coming to the ischioanal fossa, okay, the median structure in the anal triangle was the anus. On either sides we had the ischioanal fossa. What it is, let's see. It is a wedge shaped space situated one on each side of the anal canal below the pelvic diaphragm. The base is directed downwards toward the surface and apex directed upwards. We'll see this, the apex and base, in the coronal section. This is just the surface view of the ischioanal fossa. Dimensions: length anterior posteriorly it is around 5 centimeter, width side to side 2.5 centimeter, and the depth vertical around 5 to 6.2 centimeter. Right. So this is the coronal section. This is the anal canal. On either sides, on both sides, we have the ischioanal fossa. So this is basically a ischioanal fossa. So boundaries, you see, this is the base and this is the apex part. Okay. So the base is formed by the skin of the perineum. Okay. Further on, the apex is formed by a line where the obturator fascia. Okay. So this is your obturator internus muscle. आपने ये hip bone में पढ़ी होगी. So the fascia covering the obturator internus is called the obturator fascia. This is your obturator fascia over here, where it is meeting the inferior fascia of the pelvic diaphragm or the anal fascia, that is the apex. Okay, so basically this is your pelvic diaphragm consisting of the levator ani muscle, okay, and it has a superior facial layer and it has an inferior facial layer. The inferior facial layer is also called the anal fascia, and where this anal fascia meets the fascia of obturator internus, that is the your apex. Okay, and this line basically corresponds to the origin of the levator ani from the lateral pelvic wall. This is your lateral pelvic wall. I understand this might be difficult for you to understand, but please bear with it. So, anteriorly, the fossa is limited by the posterior border of the perineal membrane, but for the anterior recess of the fossa, we'll talk about the recess further on. Posteriorly, the fossa reaches up to the lower border of the gluteus maximus and the sacrotuberous ligament. The lateral wall is vertical. Here, lateral wall is vertical and it is formed by the obturator internus with the obturator fascia, the medial surface of the ischial tuberosity below the attachment of the obturator fascia. This is the medial wall. It is sloping downwards as you can see and medially formed by the levator ani muscle with the anal fascia in the upper part. Then we have the external anal sphincter medially with the fascia covering in the lower part, right? So coming to the recesses or spaces, this is the parasagittal section through the ischial fossa showing its recesses. The recesses are extensions of the particular space, right, beyond its boundaries. So the anterior recess is anterior recess extending forward above the perineal membrane, okay, reaching almost up to the posterior surface of the body of the pubis. Okay, so this is your perineal membrane, the anterior recess extending forward above the perineal membrane, reaching almost up to the posterior surface of the body of the pubis, and this part is related closely to the prostate or the vagina in females. The posterior recess is smaller than the anterior one. It is extending up to the sacrotuberous ligament. Okay? This is the sacrotuberous ligament here, posterior recess. This is the main part of the anterior recess of the ischial fossa. Now the horseshoe recess connects the two ischioanal fossa behind the anal canal. So coming to the spaces and canals of the fossa. Now the arrangement of fascia in this region is such that it is forming certain spaces called the perianal space, ischioanal space and the pudendal canal. Now here. So let's talk about the perianal space. It is in form of a septum that is passing laterally from lower end of the longitudinal coat of the anal canal, the perianal space. Here, ये perianal space है. Again, I repeat, it is form of a septum that is passing laterally from the lower end of the longitudinal coat of the anal canal, extending medially from the white line of Hilton into the pudendal canal laterally. Okay, separating a shallow subcutaneous perianal space from the deep ischioanal space. The perianal space is small and shallow, and the fat over here is tightly arranged in small loculi formed by the complete septa. Infections of this space are therefore very painful due to the tension caused by this swelling. Right. So this is your ischioanal, this is the perianal space as you can see, filled with fat. Coming to the ischioanal space, large and deep. Fat in this space is loosely arranged in large loculi formed by incomplete delicate septa. Infection of this space are therefore least painful because the swelling can occur without any tension. This is called a lunate fascia here. Lunate as in half moon shaped fascia like this arches over this ischioanal fat. It is beginning laterally at the pudendal canal. This is the pudendal canal, and it is merging medially with the fascia covering the deeper part of the external anal sphincter. Now, the fascia over here is dividing the ischioanal space into two parts, the suprategmental space and then the tegmental space. Okay, this lunate fascia, basically this is the lunate fascia dividing the ischioanal space into a suprategmental space and a tegmental space. Now this is the pudendal canal. Pudendal canal is nothing but a facial canal in the lateral wall of the ischioanal fossa that is enclosing the pudendal nerve and the internal pudendal vessels. The fascia of the canal is fused with the lower part of the obturator fascia laterally, with the lunate fascia above, with the perianal fascia medially, and with the falciform process of the sacrotuberous ligament below. Okay. So, before this, let's come to the contents of the ischioanal fossa. Ischioanal pad of fat, the inferior rectal nerve, they pass through the fossa from the lateral to the medial side, arching upwards above the fat to supply the mucous membrane, external anal sphincter, and the skin around the anus. The third thing is the pudendal canal with its contents. This canal lies along the lateral wall of the fossa. Then we have the posterior scrotal nerves and vessels, or labial in females. They are crossing the anterolateral part of the fossa, entering into the urogenital triangle. Then we also have the perineal branch of the fourth sacral nerve over here, entering the posterior angle of the fossa, running over the levator ani to the external anal sphincter, along with perforating cutaneous branches of S2-3 appearing at the lower border of the gluteus maximus in the posterior part of the fossa. So, right, coming to the clinical anatomy, the two ischioanal fossa allow distension of the rectum and anal canal during the passage of the feces. Both the perianal, which is the perianal, and the ischioanal spaces are common site for abscess formation. Sometimes an abscess may burst into the anal canal or the rectum internally and or onto the surface of the perineum externally. In this way, the ischioanal type of anorectal fistula or fistula in ano may be produced. The most common site of the internal opening is the floor of the anal crypt. If the abscess bursts only externally outside, healing does not follow and an external sinus is produced, right? Through the horseshoe recess, a unilateral abscess may become bilateral. Okay, so the ischioanal fat acts like a cushion-like support to the rectum and the anal canal. Loss of this fat in debilitating diseases like the diarrhea in children may result in prolapse of the rectum. The occasional gap between the tendinous origin of the levator ani and the obturator fascia is called the hiatus of Schwalbe. Rarely, the pelvic organs may herniate through this gap in the ischioanal fossa, resulting in the ischioanal hernia. So, this is first part of the perineum. The next will be dealt in the next lecture. Thank you.